I'm Vedica Podar, and I'm going to speak about how we can lead mental health action on a global scale. I think firstly, I want to thank the organizers for putting together another wonderful event this year. It's been a pleasure to be back. And also to all of you for all the work that y'all are doing in the space of mental health. I've heard some very inspiring conversations this morning, and I'm hoping to just be able to add a little bit to what we've already spoken. So when we talk about mental health, a lot of times we tend to confuse mental health with mental illness. So in terms of talking about mental health, we believe that if we talk about mental health, that means there's something wrong with me. And as someone in this space, I have personally faced all the stigma, which I'm sure a lot of other mental health professionals here would have also faced, that people tend to ask that, why are you doing this? Why are you spreading, this sort of negativity? Why can't you talk about better things around us? But honestly, if you asked me, I think without looking after our mental health, there's no way we can enjoy the better things that lie around us. So one of my favorite quotes to obviously begin today's conversation is that, what mental health needs is more sunlight, more candor, and more unashamed conversations. And I think generally what happens is, of course, now that we're seeing a post-COVID world, people were more open during the pandemic to talk about mental health, to talk about their struggles, to talk about, the hardships they went through, whether it was in terms of loneliness, whether it was in terms of, health anxiety and things. But I somewhere see that, we're coming back to a point where we're going back into our shells. We're seeing a lot of toxic positivity all again, where people are like, no, it's been long enough. You should have moved on from the pandemic experience. So a couple of things that we're going to talk about today, but going from there. So when we talk about the global mental health crisis, I think what we fail to take into account is that mental health isn't something that happens, just in a particular region or just to a particular gender or just to a particular age group. And as someone who's worked in both urban and rural settings in India as well as abroad, one thing that I have seen common throughout my working experience and things is that mental health is that one thing which doesn't discriminate. Irrespective of your age, your caste, your gender, your background, where you come from, mental health is something that kind of unites us all. So if 20% of the world's population is expected to experience a mental illness, 100% of the world's population has mental health. And that is one reason why we need to obviously talk about it. When we talk about in terms of suicide, there's data which suggests that every 40 seconds, an individual dies to suicide somewhere around the world. Again, something we don't talk about. We don't even, whether it's suicide, whether it's suicide-related bereavement, we forget that that can further add to someone's poor mental health. Depression, as we said, is the leading cause of disability worldwide. And one of the most alarming statistics that I personally keep coming across is that as many as 80% of people with mental health conditions do not seek or receive help. And when we look at data in India, this number goes up to 92% people not getting the help that they need. So, I know there's some doctors in this room, and can you imagine if we used statistics of that sort for physical health conditions? What if I said that, 80 to 90% people with, cardiac issues do not get the help that they need? Or, 80 to 90% people with diabetes or with cancer don't get the help that they need? All of a sudden, there would be almost like this, national, international uproar. Look at what happened during COVID, right? Like when people were not able to get medicines or medical aid or a hospital bed, it was all over the place. But we don't talk about people not getting help for their mental health. And this is something that happens on a day-to-day basis. People are out there struggling, and there's no face for poor mental health. So if y'all can remember, 2021, 14th of June, when Sushant Singh Rajput ended his life. What do y'all remember from the conversations that you saw on TV? Does anyone want to share what they recollect in terms of what the narratives around that whole thing were?
I commented on all the channels.
Okay, lovely. Yeah, if you want to just say, like, what were the kind of narratives that you saw and, like, what your fellow panelists spoke about?
Hello. Okay. So I was the one who was being asked from day one on Aaj Tak and at that time ABP News. So I could not share it to the media. On day one, I was given the prescriptions of the psychiatrist by the media.
Yeah.
I could not tell them, I could not speak in the open that, look, I know that he has been diagnosed about a psychiatric condition and he has been he has been advised medication. So in his case, he was diagnosed by a psychiatrist in Bombay, advised medication. There was a lot of issues in the family from both the sides, and somehow the medicines were not given, because sometimes he would be with his parents and sometimes he would be with his girlfriend. So it was very clear that he had a psychiatric disorder which had to be treated. Unfortunately, it could not be done. Plus, he had a drug abuse problem. The most interesting aspect, which I was not expecting would happen to me, was I was asked by Sudhir Chaudhary on Z News. They showed me two clippings of one, his girlfriend, he talking to his girlfriend in a in a manner of a drunken state, So Sudhir Chaudhary asked me that, what do you think? I said, I can't say for sure, but there is the possibility of him taking some drug or alcohol. The second one was in which she was insisting that please take medication, please take medication. So he asked me, do you think there is a possibility of him having a clinical problem leading to suicide? I said, yes, there is a possibility of him not getting the treatment and him succumbing to treatment. Since he did not get the treatment, the worsening of depression, and he went on to get the suicide. As soon as the program ended, my son came rushing. Sir, Papa, do you know you are getting death threats on social media for actually telling the fact that he actually committed suicide? So what I mean to say is, what she is trying to say here is that the narrative, what you want to accept, because he's a celebrity, he cannot have a problem. So these are the different narratives. Yeah. And there was a group who was saying that he never could have done, it was a murder. Another group was saying that, no, it can't be, there is some political conspiracy. And the third one was the saner group, to which I belong, knew that it was a suicide, unfortunately. Yeah.
Thank you.
Thank you. Thanks for listening.
Thank you. So, as Doctor mentioned that, Doctor, you didn't share the prescription, another channel did. So, when we talk about mental illness, I think the one thing that really, so when the news broke out, the first thing I remember myself tweeting out was that, obviously it is unfortunate that, somebody has ended their life, but I hope that this opens up more conversations about mental health and men's mental health in particular. Because in India, we don't talk about it, right? Like, forget mental health, men's mental health is almost as if it doesn't exist. So when we talk about things like, so personally, even if we take something like grief, okay, so we think that, this is a very feminine thing, like, to struggle with grief and, all the crying that happens after someone passes away. Men are expected to do everything, like, right the minute it happens. Someone passes away, the men of the household are expected to completely run in, take over, and the women are expected like they're not going to do anything. Because, well, women are looked at as a weaker gender, which is absolutely not the case. I feel like women are more open to speaking about mental health issues, and I'm sure a lot of the mental health professionals here would agree. But coming back to the Sushant Singh Rajput case, I felt that was a good time to start conversations about men's mental health. I don't know how many of you also felt the same. I'm sure a lot of you would have. Like Doctor, I also received some death threats on Twitter, because apparently I did not understand the gravity of the situation, and I was jumping to a conclusion before it was proven. The whole thing that really struck me about the debate that we had around suicide at that time, and I know I'm digressing a little bit from here, is that there were people, kind of putting out these photos of him looking very happy. There was a huge debate around, but he looked like he had everything in his life. why would he do such a thing? And that is the thing. Mental illness and poor mental health doesn't have a face. There is no look, there is no type. I know we expect somewhere, partly because of media, that, people who are struggling with mental illness are going to look a certain way. They're going to behave a certain way. You will not expect someone with mental illness sometimes, like they're going to be a speaker at a conference, or, they're going to be a celebrity. You're going to think that, no, this is someone looking very deranged, lost, walking on the road, aimless, hopeless, sitting in a room crying. We don't associate poor mental health with somehow people having it all together, which is why a lot more people have to suffer in silence. Again, another data point, people with mental illness lose up to 10.1 years in terms of life expectancy. We don't talk about it. We don't talk about how people are going to live a shorter lifespan, a poor quality of life as a result of their mental illness. So when we talk about global challenges, and the reason I'm touching upon global challenges is because today, there's a lot of stakeholders here from around the world, so I thought it's a good chance to talk about some of the global issues. And what we realize when we talk about these is it's not just an India problem, it's not just a UK problem, it is a global problem. And we need to do something about it, right? As I said, I have worked briefly in the NHS, I have used services by the NHS, and I have noticed that it's not just in India, but it's also that healthcare systems abroad are overwhelmed. So firstly, we have inaccessible healthcare services. So when we say inaccessible, it could be, in terms of location, it couldn't be in terms of price, it could be in terms of affordability, it could be in terms of accessing that place, physically getting there, or wait lists, things like that. Next is the dearth of qualified professionals. I don't think I need to get into this too much. Prevalence of stigma and barriers of treatment. I know the previous panel briefly touched upon stigma. I think when we talk about stigma, especially around help seeking, the stigma is so prevalent that sometimes we feel, and I'm sure the psychiatrists here might have seen it, that not just self-prescribing and self-medicating and of course using Google now, but people feel that if they go to therapy or if they get on medication, this is now a lifelong thing, that I'm going to spend the rest of my life suffering and there's no hope for me at the end of that tunnel. When we talk about fragmented systems and poor quality of care, I think this is one of the key challenges. And of course, as my organization, as the work that we do at Kangaroo Minds is something that we try to overcome, because we see that professionals don't talk to other professionals, right? And I think briefly it was touched upon, I think in the last panel around psychoeducation. So typically, we don't see GPs easily sending referrals to psychologists, or psychiatrists. A lot of times we will see that GPs themselves like to prescribe psychiatric medication. Psychiatrists don't really like to send people to, psychologists. Counselors don't like sending people to psychiatrists. So it's a very siloed world. And what happens at the end of it is that the person struggling doesn't get the care that they need, but also the care that they deserve. Because one thing that I'm sure we all agree upon, and I've been a huge advocate for, is that nobody deserves to suffer in silence, right? So if you're struggling, you deserve help. And what we forget is how closely mental health is related to our physical health. And this is one of the saddest things in this space, is because a lot of times we forget that the brain, head and above, is also part of our body. So if we're struggling mentally, there are chances we're going to struggle physically. If we're struggling physically, there are also chances that we're going to struggle mentally. Limited research and understanding, and of course the last is in terms of where the world is heading now. So we see a lot more trauma, we see a lot more conflict, we see a lot more refugee crises, whether it's in the Middle East, whether it's in Ukraine, whether it's in Myanmar. So all these kind of things sort of contribute to poor mental health and systems being overwhelmed. This is something that I feel we overlook when we talk about mental health. when we talk about mental health, sometimes, we think about it as just purely a biological, psychological issue. It only has to do with, that one person alone. And we forget that we do not exist in isolation. As human beings, we exist in a social network. There are people around us. We are social beings. So the world around us does have an impact on our mental health. So when we talk about healthcare, when we talk about revolutionizing mental health, I think it's not just about having more mental health professionals and, having more psychiatrists, having more clinics, having more conversations. Yes, all of that is important, but it's also important to address a whole bunch of underlying factors which can impact an individual. So things like unemployment, lack of education, lack of sanitation, food poverty, poor workplace conditions, war, human rights violations, gender and sexuality related discrimination. I think these are all things that we know that they exist. We just forget that, it impacts a person's mental health. So for instance, if I told you that think of somebody who is homeless. So think of all the challenges that individual is facing, right? And they might be struggling with, let's say, for instance, addiction or depression. But they don't have food, they don't have shelter, they don't have a job, they don't have income. Do you feel if you try and address that person's mental health without addressing all the underlying causes that are contributing to their mental health, it's not essentially going to be a holistic, all-round, and a full sort of 360 approach to helping that person? So when we talk about mental health, I think it's very important that we take more holistic approaches. And when we talk about biosocial-psycho models of care, we cannot ignore the social aspect of mental health. So what happens when individuals struggle with their mental health? And I don't want to get too much into this, but these are things we've briefly touched upon, right? There's a decreased quality of life. They're likely to withdraw. They're going to have, they're going to be less productive at work. They're going to be their chances of completing education or having positive educational outcomes are going to be much lower than the general population. It is a cost to the healthcare system. I know a lot of times we don't like talking about this and being no, how can we talk about, that this is not right to quantify this as a cost? But let's be real, it is a cost to the healthcare system, because especially in countries where inpatient treatment is common and there is a shortage of beds, it's always deciding who gets that bed, or how much gets allocated to treating people. So it is a cost on the healthcare system. They're at a higher risk of suicide and substance abuse. And of course, it's going to have an adverse impact on everybody around them, because as I said, individuals, we do not exist in isolation. So now why do we need to, talk about this? Why do we need to do something about this? And I've always looked at mental health, mental illness as sort of that elephant in the room. We all know that, yeah, we need to talk about it, but do we do something about it? And honestly, when we talk about mental health awareness, personally, I feel like we have done a lot of awareness. Whether it was in COVID, people are aware about mental health. Where is the acceptance? Where is the acceptance of mental health? It's okay. We all have mental health. We're all happy to talk about mental health, mental illness, as long as it's not happening in our household. Let's be very real right now. Let's not sugarcoat this. It's all fine जब तक हमारे बच्चे को कोई problem नहीं होनी चाहिए, या हमारे घर में we are all fine. But when we talk about 1 in 5, that's effectively 1 per household. So somebody is struggling, right? We're not talking about it. So where is the acceptance of mental health? And until we reach a stage of acceptance, we're not going to be able to lead action. So a lot of us mental health professionals here would be on that action phase of mental health. We're doing something, we're trying to make a change. But as far as the common public is concerned, I think somewhere we need to work towards moving them from awareness to acceptance before we can expect them to take action on mental health. So why do we need to do something? I don't think I need to say too much about this. You all have heard a lot this morning. But as I said, nobody deserves to suffer in silence, and nobody deserves to suffer for something where there is help available. If you have a chance to feel better, why not feel better? Why not do something about it, right? And of course, like I come from a place where I have worked in, as I said, in rural India, and I have seen, like, firsthand the impact that talking about social causes has on people. And I think all of us, in our individual capacities, has a responsibility to leave the world in a better place than what we found it. So in terms of the responsibility to make a difference, a lot of times we feel that, oh, I'm too small, or I'm just one person and this is not going to be enough. I hope we change that mindset and remember that, each person can make a difference around mental health. So I'm just going to share a few of the new trends that have come in the space of mental health, which we can, draw upon. And I know a lot of these are subjects of panels today and of conversations today. So collaborative models of care, digital health, and influence of AI. So this is something that came up in COVID as well. And when we talk about collaborative models of care, it's around social workers working together with GPs, with doctors, with psychologists, with psychiatrists. So it's about bringing together people to ensure that people get the best care that they need. AI, digital health, these are all things that, we kind of saw a lot in COVID. I think the world is finally, in some parts of the world, we are now seeing community-based mental health care. That is one of the things that even we work towards is, going into communities, working with communities. Early years intervention. So for a long time, we believed that mental health, okay, it happens, but it's not for children. Don't talk to children about this. How can you tell our child about these things? But children have mental health. Children have emotions. Children need to be taught how to express their emotions. And of course, there's enough data to suggest that more than 50% mental illnesses tend to be established by the age of 14. So there is obviously a huge, huge need for early years intervention. I know I'm not going to get too much into workplace and well-being measures because I know the previous panelists did touch upon those topics. But when we talk about workplace mental health, I think, and I hope, for everyone here, and I know there's an HR conference happening in the next room, but I think what's happening is we're also heading towards a lot of wellness washing. And when I use the phrase wellness washing, a lot of y'all have heard of greenwashing. So what is happening is that companies now want to show that they care about mental health. So 10th October, World Mental Health Day, 9th September, Suicide Prevention Day. So we will do a lot for the cause on those days. You'll organize yoga once in 2 months and things. But it's like, how much of a safe space is your organization? So those are things we need to, really start looking into. And finally, I know I've already spoken a lot about this, but these are some ways in which we can all make a difference. So if you spot stigma around you, call it out. Educate somebody around you about mental health and mental illnesses. Learn about it yourself. Promote mental health literacy. And as I said, the way we talk about mental health matters. So how many times we would have seen in schools, we see children using the words depressed, anxious, anorexic, bipolar, psycho very, very casually. And forget children, even we tend to do it sometimes, don't we? Oh, I'm so depressed today. Or, the weather is so bipolar today. Let's learn to do better. I think mental health terms are not lingo. They are not words to throw around. You will not throw around words with physical health conditions. You will not be like, I feel cancerous today. I feel, diabetic today. You won't say those things, right? So why do we find it so easy to throw words around mental illness? Advocate for policy change and to address the social determinants of mental health. Because as I said, at grassroots level, there's so much that we can do around mental health. It's not just for healthcare professionals, it's for everyone. And finally, encourage self-care and healthy coping mechanisms. So look after yourself, look after everybody around you as well. So that is it from me. I know we're out of time. So let's lead the change. Let's be the change that we want to see in the world. And do we have time? Is there anyone wants to ask a question? I think we have time for 1 or 2 questions. Otherwise, we can talk outside as well.
How do you genuinely support the employees on mental health? So I was just seeing a woe bit. I just messaged my corporate managers about the woe bit. So we have some things like that, but then how do you genuinely, I know I'm also part of the senior management. Yes, Sometimes we tend to do that, but then how do you genuinely conduct such support to the employees?
So one of the things that you could do is have, have conversations about mental health at the workplace beyond doing yoga and I worked in corporates. I know what we did. We made rangolis and, all of those things. But talk about it. Include mental health as part of the employee insurance. Because technically, as per the Mental Health Care Act, mental health services are supposed to be covered by insurance policies. So make sure that the policies that your employees get as part of the group insurance and things cover, mental health related care. You could encourage conversations. You could run training programs. You could, for instance, that's one of the things we do. So we do a lot of training around, mental health ambassadors, suicide prevention, all those things, so that you build safe spaces and also ensure that people in your workplace talk about mental health very empathetically. So if someone comes and talks to you saying that they're struggling, they should not feel that they're going to lose their job because they came and said,
That's what
I'm
I was
struggling with depression.
about to ask. It's such a taboo.
Yeah.
The moment you come up and say, I'm depressed, I'm distressed, definitely there's a fear factor of you losing the job. So no employer would want a sick employee, in the sense there are sick days and there are they call it bad wives, whatnot. I'm not kind of a thing, but then yes, being in the ethical committee, in the governance committee, I do get these cases, and yes, we are, as senior management, we are empathetic towards the employee, but then sometimes it is difficult when people are behind profits and EBITDAs and all those things.
So you could have something like a mental health day. You could encourage people to take a mental health day. You could encourage them to have boundaries. And if you find that they're consistently slacking at work, you could probably keep an executive coach or a counselor or a psychologist who comes in, once or twice a month or things to the workplace where people can go and talk to her and ensure that confidentiality is maintained. So if she can help them, so instead of telling someone that, you're being lazy or, you're not working hard enough, they're not probably going to want to open up anyway. People are struggling. And as we said, mental health does take a toll on an individual's productivity. So if we allow them to feel safe to come and speak to us, they will feel more heard, more seen, more validated.
Even we tried arranging for an external hotel, because the moment you have these days, and those days you see this employee coming to the HR, and it goes like wildfire, and everybody talks about that this employee is going through some mental thing. So we did go out, have the psychologist and go out and not meet in the workplace. So that's one of the we did test it. It didn't work out still, but then yes, the.
At workplace has two faces. So one is that the employees do not feel supported, because once a month, twice a month would not work, because I seriously feel every family has one or two people going through mental health concerns, mild, moderate, severe, whatever degrees. So they do not feel enough supported. So actually the conditioning, the children whom we have now, they need to be conditioned to talk about mental health since childhood, so then we'll be having a generation like that. The second phase at workplaces is that people hide behind their mental health issues. Some people misuse it also. Also, if you have a psychologist for a senior level group of 10 people, then for the level above that, we'll have to have a different psychologist, because there are dynamics going on within the organization also. So if this level has a particular person, to maintain the neutrality, confidentiality, we need another psychologist for a higher level management also. So actually more and more professionals are needed, and actually full time. So we have psychologists on board. Yeah.
But then we tend to not use them. We want a psychologist from outside. But then still it is taboo. Though we might say, that was my question was, how can you genuinely want to help them?
So people have to
Can I-
become okay
So-
with having
so-
a mental health issue. You know, having clinical depression or having anxiety and taking it like, you know, physical health, which will take years and years to
Sir, we
come
are breaking for
actually.
lunch
Yeah,
as it is,
please.
so we
Yeah.
can discuss.
I just want to say one practice we do for this, for mental health at workplace. So I'll tell you, you know, few of the employees who come to us, we in fact tell them, please don't discuss to us, otherwise we will go into a judgmental mode. So what we have is we have a platform which is called as Mind at Ease. This is our internal platform where we have the psychiatrists, psychologists, and we, you know, we really encourage people to go on this platform. This is an internal platform. And then they take one or two sessions. There is no, you know, selective thing that you go to A, B. So we have a list of psychiatrists and psychologists with us who are free of cost. So what is the deal as a corporate from us to them is that we will be paying initial 1 or 2 counseling which you will be giving to our employees. Moment, you know, they feel, because they are experts in that, so moment they feel that they need some, you know, help further, then that has to be bare between that particular person who is enabling or getting the services and the psychologist. So this has worked very well because, you know, what has happened when the employee come to us and it's like, ma'am, I'm facing this issue. I said, fine, thank you, you came to me. But yeah, I mean, I would encourage you to go on this platform because I don't want to go into a judgmental mode when I'm giving you another task. So that has boosted up her, you know, confidence to go on Mind at Ease and, you know, really put up whatever issues they are facing, maybe a workplace, maybe it could be a personal also. And similarly, one platform we are using for our students because we are an institute. So what we can do is we can use these technologies more where, you know, people are free and, you know, out of that fear of that, you know, whether I would be, you know, judged on this or is it any taboo or something, and use it in such a way that it has an end action to it. So, I mean, we are very glad we have seen that, you know, when we brought this Mind at Ease, there are 4 to 5 employees who really came out of that, and then they come, you know, had it been in any other organization, we would not have got that support. So that's
Thank you.